And welcome back, everybody, to Phrases Presents, the pre-admission game. It's lovely to have you with us again for yet another episode of our University Overview series, where we take a look at the universities, the medical schools, I should say, what the course looks like, what the values are, what the interviews at that particular medical school are all about, so you guys can make better decisions about how to prepare, what to say on the day, and at the end of the day, which shoe fits, which university you'd like to go to. And with us today, throwback to earlier episodes, which is going to keep the shoe motif recurring. So joining us today is my one and only conversation partner, Mitch Gordon, who you have no doubt all been familiar with through the course of previous episodes. How are you doing today, Mitch?
Yeah, I'm doing well. And I suppose it is fitting that I present my own university to you and try and give you some background information about the University of Notre Dame, Sydney. You can hopefully put your best foot forward and make sure that shoe is the right fit.
Absolutely. But I mean, Mitch, you have around 4 years experience at Notre Dame, isn't that right?
That is true. I'm a fourth year student currently at Notre Dame. Thinking back to the traumatic situation that was my medical interview, I do remember it, reasonably well. So I'm hope that I can give you all some insight into what happens and how to prepare best for your Notre Dame interview.
Absolutely. Now, for those of us that haven't necessarily been listening from the very first episode in this season, can we do a quick recap of who you are and how did you get here?
My name's Mitch. I'm a fourth year at Notre Dame University in Sydney. Having said that, though, and one of the great things about Notre Dame is that you have multiple medical campuses, so clinical schools, in different states. So in Sydney, where you do your pre-clinical education, everyone's up in Sydney, you actually have the option to come down to Melbourne for your clinical education. So I'm currently in Melbourne doing my final year of clinical placement.
Oh, that's interesting. So you sort of have one foot in both states. You have the opportunity to do your Sydney placements, but at the same time, you've been doing a couple of placements here. I thought you said you went to Werribee and you spent a bit of time in St. Vincent, so it's quite an interesting spread.
You get a great spread and you get exposure to lots of different hospitals, predominantly Catholic hospitals, and that's owing to the fact that it is a Catholic university. The cool thing about the different states is that you, at the end of your degree, so now we're getting really protracted here because we're thinking about the end of your medical school career, you can also end up applying to both Sydney and Melbourne at the highest preference order. You can end up with a good job in Sydney or in Melbourne, which is really, useful for people who aren't sure where they want to work.
So it's about keeping your options open. You're sort of preferenced for internships both in New South Wales and Victoria, regardless of where you actually do your clinical placement.
Definitely.
Because the university sort of spans two states.
Yeah,
is that
absolutely.
Right?
That's right. And it's a really good asset to the university, in my opinion. I think that the states find it quite difficult to deal with us in terms of administration, but it's great for you as a person thinking about where you want to go for your medical schooling, the fact that you have these options. So in terms of where I've been, I suppose I did my preclinical education up in Sydney. So everyone's up in Sydney. The cohort's about 100 or so students.
But before your admission into medicine?
Before medicine, I was a biomedical student at the University of Melbourne. So that classic sort of science, biomedical type background. A good thing about Notre Dame is that you do have that 2-year pre-clinical period to really come to grips with all of those sort of scientific and medical concepts. So really for those of you who aren't from a science background, it's a great medical school in that you have time to get to grips with all of these sort of foundational concepts of medicine. For me, I found it slow in some respects, but in that time you have more time to think about your clinical skills and your approach to clinical examinations and things like that. There's so much for you to learn in the amount of time you have at medical school. I wouldn't think that the fact that you do 2 years of foundational sort of preclinical learning is any detractor from the school itself.
Absolutely, absolutely. Now, how have you found your medical journey so far overall? Just in terms of what is your experience in being like? We've talked to a lot of people about the academic side of things, the course structure, and we'll get that in a second. But have you found it to be, well, I guess colloquially, have you found it to be a good time? Has it been worth it for you so far, the medical journey?
And I mean, ultimately, my quest, when I was an undergrad, thinking about my application to medical school, you're wanting to get into medical school. And I made that very clear with myself, that I would pretty much go anywhere that would accept me. And Notre Dame just happened to accept me, and I was really happy with that. And looking back now, it's been a fantastic experience for me. The cohort size is small. There's loads of social engagements like throughout the weeks and throughout the year. So it's a really like close-knit cohort, and you actually get to know people from, the cohort above, who you have a bit to do with you sort of in the first couple of years, as well as the cohort below you as well. So I think there's a thriving medical student community at Notre Dame. It's also very social justice focused, and I think that's really important for people who are thinking about applying. This is a uni that's very social justice
What do you mean
oriented.
by that?
I suppose it's this concept of recognizing that there are inequities in our society. And I don't need to list them off. I'm sure that you've all thought about it if you're thinking about your applications for medical schools. And Notre Dame really does want to have students in their ranks that are thinking about, wanting to rectify some of these inequities. And, the university does a social justice project throughout the university, which I think is a really great asset to the university's program, which gives you credit for volunteer work and other sort of leadership initiatives that benefit, everyone in society, particularly those who are in need.
Interesting. Okay. So is that sort of a spin-off of the Catholic values that you mentioned before?
Yeah, absolutely. It's inspired by Catholic values, but that's also just a feature of Notre Dame's way of thinking about medicine, I suppose. You could think of it as a Catholic concept, and maybe it does have some academic Catholic foundations. A lot of these religious concepts are something that you shouldn't think of as the be-all and end-all of the university. Yes, it's a Catholic school, but just think that it's Catholic inspired. But a lot of our Western values are also Catholic and Christianity, sort of Judeo-Christian inspired anyway. So you really won't feel like you're in a religious institution, too much or anything. I mean, as a non-religious person myself, I haven't found it to be at all, overwhelming.
My follow-up question to that is that somebody from a different denomination or somebody who perhaps wasn't particularly invested in religion, would they feel like a fish out of water at any of these universities?
No. And in fact, like if you're from a different faith, that's absolutely fine. And I think it's brilliant in many ways because it brings a different viewpoint to the conversation. And the great thing about Notre Dame is that they really want you to become an ethical doctor, and with that social justice focus as well. So if you have a different, religion or a different, viewpoint, it'd be really useful to add that to the conversation. And ultimately, that strengthens the overall cohort's understanding, which is really, really great.
So that's very, very interesting. And I've heard you talk, outside of this podcast many times about the emphasis on medical ethics, which, again, and we'll talk about this later with some of our future interview guests, is not as strong at other universities, certainly from personal experience, not at Melbourne University. You don't get that strong bioethics focus. It's very much more academic. We've had a chat about the values that sort of encompass Notre Dame. Can you tell me a little bit about the structure of the program? What does it actually look like on the ground?
Yeah, so it's similar to ANU and a few other universities in that you have these 2 years of preclinical periods where you just sort of refine your clinical thinking skills. You learn all of your physical examinations, but you don't actually have a great deal of patient contact. Now, that will be a drawback to like a limitation that some of you, might think. For me, anyway, I did find that by second year, midway through, I was just, hankering to get into the hospitals and start my clinical training. Because I think there's so much that you can learn from the hospitals that you can't pick up from a textbook or from any facilitated learning environment. And by facilitated learning environment, I mean the PBLs, which is the structure that we learn and are delivered most of our course material.
Right. Okay. So it's that 2-on-2 program, I guess. If you guys listened to the ANU podcast that we did, we referred to the 2-on-2 program, which is you have 2 years of preclinical preparation and then 2 years of clinical work. And that's the model that I guess both Notre Dame Fremantle, which is the Perth affiliate, and the New South Wales Notre Dame and Sydney affiliate both adhere to. Right?
Yeah, definitely. Okay. And I mean, so if you come from a non-science background, you have so much time to learn all of the sort of the pre-medical stuff that you need to enter the clinical environment. If you come from a strong science background, you might think that you know a lot of stuff already. Like, that just allows you to enjoy medical school and to, have time for other things, which are really important.
And you come out equally qualified on the other side.
Oh, definitely. Yeah.
Absolutely. So it's really just shifting things around. Even the schools that engage in a 1-3 program where you have 1 preclinical year and then 3 years of hospital training, you're still getting those supplementary tutes in those clinical years. They're just interspersed.
Definitely.
Right? Whereas here they're condensed into 2 years. Yes, this should be one of the things that you consider when you're university shopping, but it's certainly not something that should make or break your decision. It doesn't impact the quality of the education that you're getting.
And you're still learning so much. I mean, you don't think about it. Like, yes, there's the textbook learning, but then there's also the professionalism learning and the, research learning that we've touched on in other episodes as well, where, there's so much more to your medical education than just understanding, that clinical method that sort of is so commonly taught throughout medical school. And it's so important, but there is other stuff as well that you can also learn.
Yeah, well, you have to remember that it is a little bit of an apprenticeship. It's kind of like becoming a plumber or an electrician or really anything where you are learning from the guidance of your betters, really, people who are already in the professional field. And you're going to get that regardless of what setting you observe that professionalism in.
Yeah,
so
definitely.
We've had a chat about the program structure, and you mentioned before the research. We sort of touch on it because it is a recurring theme in med, and we've talked about it in the other podcasts, and it's a recurring theme in med degrees nowadays. So can you tell me a little bit about the research component of the Notre Dame medical degree?
Yeah, and while I'm there, I'll also talk about the ethics component. There is a big MD focus, like every other medical school. You have to do some sort of research project throughout your degree. It starts in first year with the sort of selection of your project, and then as you move through, you're supposed to chip away at it over time. And you'll find that if you're really invested in what you're doing, you can get a lot of stuff out. If you're wanting to collect your own data, that's also fine. But if you're wanting to do a more modest project, you can also wait until 3rd or 4th year to really get your teeth into it. So I wouldn't say that research is the biggest asset of this university. I think what really sets it apart is this bioethics program. Early in first year, you have a full-on bioethics intensive where you learn all of the big concepts in bioethics relevant to medicine. And in addition to that, you get guest lecturers coming in every week to give you some sort of new ethical insight. Often it's got a Catholic swing to things, so prepare to be challenged if you're not from that school of thought. But at the same time, it's brilliant because it stimulates conversation, and ultimately, it's not about narrowing your vision into what your worldview is, but also about understanding other people's worldviews. And ultimately, that's what you're going to be doing as a doctor anyway. So
I think it's interesting. We've previously touched on the concept of publish or perish, emphasizing the importance of research. But really, as a clinical specialist, you'll find that you make ethical decisions just as often as you make research ones. You still have very difficult cases daily from a social perspective, from a medical perspective. Do we operate? Do we not operate? And all of these things that are discussed at multidisciplinary meetings and are just really a mainstay of your profession. There's no textbook for them. Nobody prepares you for this. So whether you are good at them or not, it also correlates to the sort of training and experience that you've had.
Absolutely, and I think it's the kind of understanding that will lead to you making good decisions that benefit the right people for what you're trying to achieve, and ultimately you'll be able to go home at the end of the day feeling like you've made the right justified decision, which is protective for many reasons,
Absolutely.
Like mental health and whatnot.
Mental health and career satisfaction.
Absolutely.
But for all the people that are going to inevitably accuse us of being very fluffy about this concept, if you're worried about getting into future training programs and the respect that the hospital accords you, you are selected effectively by components of your hospital to advance in your career. Like you're not plucked out of a hospital and given a training position or a specialty.
No.
You're picked by colleagues, members of your department that believe that you have what it takes to sort of progress into college training. And while research is something that buffs out your resume, absolutely, practical, real-world doctoring and making difficult but good ethical decisions is just as, if not more important. Right?
And Notre Dame has that professionalism and an ethical-minded practice, really at its core. So it's a really strong university. I don't want people to think because, and I am biased, but I'm also just objective in saying that yes, Notre Dame is not a world-ranked university, but
it still is. Every medical school, it still is. But maybe it's no I don't know, maybe it has less publications than USyd.
Absolutely.
Yeah,
It's not a USyd or a Uni Melb, research output focused university, but they develop great grads. I mean, maybe aside from me, I have full confidence in like the how like they're going with producing great graduates. So really, don't be put off by that at all.
Well, we better stop talking about how good the program is, because we risk sounding defensive. I think. But and then we'll move on to the next part of the discussion, and that really is a chat about the interview. So we've talked about the Catholic values. So I guess the first question I have for you is, how did you feel with the interview? And also, this is a portfolio university, so we should probably chat about that. Did you feel pressured to include these Catholic values in your application?
Look, the university asks you in the application, what your denomination is or whatever you subscribe to. But I don't think that's a massive focus. At the end of the day, what they're trying to do is they're trying to get good people that are going to become great doctors, and and they need to fit in with the university's values in some way. And I think that's not dissimilar to any other university. You can learn from this for any other medical school. They want you to fit in with their university culture, and they want you to become a productive member of the medical profession. That's what they're trying to garner in that interview process. So how did I feel coming into the interview? Like it was scary. we talked about in a previous episode about thinking about the GEMSAS universities and what you do in the lead up to it, and you only have one shot, so there's a lot of pressure on you to excel in this interview. It's ultimately you just have to think on the day, how do I do this logically? Hopefully I've done some preparation, and you should do preparation. But it's really like any other university in terms of the MMI format and just going about it in its normal way. Catholicism doesn't really feature in the MMI in the interview.
So you didn't explicitly mention it in your portfolio?
No.
You didn't explicitly mention...
You could, because ultimately the personal statement is personal. So if that is a feature of you, and if that's something that you that is important to you, then definitely tell the university about it. And
you don't want to be a sycophant or a suck-up to the admissions committee, because people see right through that.
Absolutely, and not everyone is someone who lives and breathes Catholicism. The university doesn't expect you to be that way. But
they'd be out of students if that was the case.
Well, they ultimately they want the people that are going to become the best doctors and make the university look as good as possible. And that speaks for every university, really. So in the interview, I think you just need to be thinking, what is this university after? They're after reflective people who are going to learn from their mistakes, people who are going to be very strong in their professionalism, so people who are going to be professionals, which shouldn't seem like a difficult thing, but in many ways that the medical profession is quite conservative in certain respects and has these very unusual old-fashioned hierarchies. But it's important that we are able to conduct ourselves in a way that's going to be facilitative of relationships in the hospital, and also.
So when they say Catholic values, they're really casting the net wide here. There's, we're talking about kindness that is reflected in professionalism.
Definitely.
They're talking about, hard work in the hospital setting, that sort of stuff. Not holier than thou pious.
Yeah, absolutely. We're talking about being kind to people and, being a compassionate person. These things shouldn't be hard, and hopefully they would be things that, are present in anyone from any other university. I think it's just Notre Dame in particular is really looking for them in that interview, stage.
So how did you prepare for this then?
So how I prepared, I suppose I probably prepared in a way that I wouldn't recommend others to prepare. I sort of practice with friends, which I think is good, and definitely everyone should do it.
But
I did not practice specific questions for Notre Dame. So thinking about the university and answering my questions in a way that I think my university would want to hear, going back to those values and things like that. Whereas I practice with people who are applying to Melbourne University and other universities, and I think that it's really important that you make sure you spend your time doing university-specific MMI practice, because they are very similar in many ways, but they're also a little bit different in what they're after. Think about being compassionate, being empathetic, having good communication skills, which is general to lots of schools. But I think in particular, just showing that you can be a reflective, compassionate person who's socially justice-minded. That's the kind of thing that Notre Dame's really after. And I think that's what you need to be trying to put out.
And I guess this could be said for most universities. At the end of the day, for example, USyd, when I was interviewing there, they asked me all sorts of MMI ethics scenario questions, but they never asked me about why I wanted to go to USyd or what my motivation was. Whereas Uni Melb, that question is almost guaranteed. And why did you want to come here? What have you done to prepare for medical school? And even if I was ready for the general questions, if you get a question that you don't anticipate, even the format of you shot yourself in the foot by not thinking about how you could go about answering that. Yeah. So Notre Dame is really no different to most universities in that perspective.
Absolutely.
Where you have to come in with a game plan specific to that university.
Yeah, so I'd say the takeaway is just, know your university and prepare specifically for the questions that they're going to ask. I mean, we won't go into the specifics of what the questions are, but I think you can appreciate that
for legal reasons, yeah.
that universities are, similar but also unique in what they're after. Okay. And hopefully I've been able to sort of give you an idea of the kinds of things that they're after at Notre Dame.
Right. And it is an MMI. I think that we might have glossed over that, but it's an MMI interview at Notre Dame. Is that correct?
Yeah, mixed multiple interview.
Mixed multiple. Mini
multiple. I mean, never know what it is.
This is also going to be one of the running jokes. Okay, good. Now, I'd like to talk about something else, which is what I like to call the stiff upper lip factor. So we know that some interviews, some medical schools, I suppose, are a little bit more relaxed. Certainly we see that around the northern coast of Australia, places like JCU, which are very rural-minded, might have a more relaxed attitude. What is the stiff upper lip factor in Notre Dame, given that it's a very inner-city university, I suppose, in Sydney of all places? So what kind of dress code did they expect in the interview, and what kind of tone do you need to strike?
Yeah, look, I would like to say that it's not a stiff upper lip, to quote you, university, but I think it is a very, it is still quite a serious school, and I think on interview day, in particular, you do need to be thinking about being reasonably formal. So I didn't personally wear a suit, but I don't think that would be inappropriate.
But you still wore a collared shirt.
I wore a collared shirt. I tried to dress, how my GPs dress, essentially, like trying to think, what is a doctor that I understand and, want to be like? How do they dress and how do they behave? And I tried to just to feed off that, and it worked for me. But, thinking about, the tone of the university and the university interview, is it a casual affair? No, it's not. It's an uncomfortable, quite formal affair, really. and that might be in contrast to other universities like JCU, as you say. You will be competing against people who are very professional. Notre Dame has quite a mature cohort, so that's important to note. There will be people who are lawyers, people who have owned businesses, run charities. That they're very high-functioning people that are very successful in other careers that have decided to come over to medicine. And I think that without trying to make it seem inaccessible, it's still accessible, but I don't think it's a place where you will get away with behaving and looking like a student. You need to look like a professional, and I think that's important in particular for Notre Dame.
Having said that, we should also obligatory mention of the fact that gold chains and Armani suits, that's not part of professionalism.
No, absolutely not.
It's not about the money, it's about looking appropriate.
Absolutely. Yeah, it's just, no, and you don't have to be,
flashy suits, flashy colours.
Absolutely not. No,
not
you don't want to look, like you've just stepped out of a Learjet or something like that. Exactly. You want to look like someone who's respecting the occasion, and showing respect for the university by dressing, as if they put effort into it. And I think ultimately you need to show that you're an open person. And I think that can be lost if you're wearing tight ties and things like that. So really just strike a balance of feeling comfortable and looking open in your body language, but also, recognizing the formality of the interview.
So that's a no on the 3-piece and the golden watch.
That's a no. That's a strong
probably not. Yeah. Beautiful. Now you mentioned something else that I'd like to touch on, and that's the cohort. You said the cohort is usually quite mature, so a lot of them are professionals. So how does that come to be?
So it varies year to year, but I suppose it goes back to that portfolio that the university is.
So what is the portfolio? What do you actually have to do for that?
So the portfolio is a part of the application process. So this is before the interview, and that's where you're going to have to sell your life experiences to the university. It's more about showing that you have skills and leadership.
So what's the actual format, though, of the portfolio?
The format of the portfolio is there are I think there's 4 sections. It's been a while since I wrote my portfolio, but there are a few sections. I think leadership, community service, and then two others. I think it's like a performance in a life endeavor and something else. You have to read the guide. Sorry. The point of it is to just quickly talk about the experiences that you've had, so the university gets an impression of who you are as a person and what you could bring to the university. And I think for people who have these professional backgrounds, lawyers, people who have worked in a pharmacy, people who have like done various things throughout their lives, they have interesting things to bring to the table. And overall, I think the university, without knowing anything about their application process behind the scenes, it seems like they're curating a cohort of different people that are going to, be able to cross-pollinate ideas and learn from each other.
Are there any particular specialties that tend to recur?
Yeah, we get loads of pharmacists and physios, and they're brilliant because the pharmacists know everything about the drugs. So when we're going through a PBL, and PBL is something we do for all of our learning, you learn from your colleagues. So having a pharmacist in the room is fantastic because they know straight away what the drugs are and what's going to interact and what we need to be mindful of. So it's like, oh, thank goodness they're here. And then the physios are fantastic for all of those musculoskeletal, anatomical type questions and understandings, and also for learning musculoskeletal examinations. They're like the best for that. So
very finicky exam.
Yeah, absolutely.
Lots to learn.
Yeah, there's plenty of them, but then there's also people from different professional sectors, scientists, people with PhDs and things.
A few people from the military, in my experience.
Yeah, exactly, and people from the military as well. So there's a lot of experience coming to Notre Dame, and that to me is one of the coolest things about the university.
Yeah. So it sounds like the portfolio is a bit of a resume elevator pitch, where rather than listing off the stuff you've done, you cherry pick the most important experiences and then you try and pitch them to the university in a way that shows you off in the best possible light. Why this resume, why this person? Is that a fair description?
I think that's fair. And then to top that off, you have this personal statement element, which is going to it'll make or break your application, I think, where you really just talk about yourself and your personal motivations towards both medicine and Notre Dame. And I think there's loads of free resources and things online about how to go about that in more detail. But just to say that it is very important and you should spend a lot of time on it because it's something that the university takes very seriously.
And something that our team at Fraser's, they read quite a few of those, I hear. But beyond that, I guess my question is, if I'm running the gamut of the Gemsas universities and I'm thinking, where should I apply? If I'm an undergraduate and I have brilliant marks, but I don't necessarily have a lot of life experience, I haven't necessarily volunteered and I've been working at the local cafe, focusing on my marks as a lot of people are. Is that something that would suggest that I should drop Notre Dame a little bit lower on my list?
Look, I think if you haven't got these assets to your portfolio, I would probably consider not applying in the first place because you remember you only have is it five or six?
There's a few.
You have a limited number of options, and I think that you have to remember that there will be a lot of competition on these points of the portfolio. So it's important that you really do think about your skills and what you've done in your life, and if you can't really assemble a portfolio based off what you've done at present, it would be worth thinking about other universities for that particular application cycle. And then depending on how successful you are with those universities, you might want to think about some other things that you could add to your portfolio in the season coming around to apply.
Exactly. It's also worth having a chat with somebody who has some portfolio experience to determine whether you do have a portfolio.
Yeah, absolutely.
So it's not always evident whether you do or you don't. The thought process should be, do I want to go to Notre Dame? And if the answer to that is yes, right. The next question is, can I assemble a portfolio?
Yeah, absolutely.
Right, and how can who can help me assemble that portfolio, and what are the relevant things that can go in there? Okay, all right. So we've had a bit of a chat about the portfolio. Let's move on to the meat of the interview. So MMI, I'm guessing that means one examiner per room.
Yep. Exactly, and for me it was a standard interview for MMI where you just sort of run into the room and hopefully not too quickly. And
remember to knock on the door first, say hello, introduce yourself.
Yeah. So you're obviously quickly building rapport with the examiner and trying to answer the question that you've been given on the door. And it's a very standard MMI in that sense. They've had to go online as of recent times because of COVID, but knowing the university, I think they will be eager to go back to in-person MMI interviews as soon as possible. So if you're thinking about what should you be preparing for, I think if we can't get on top of this COVID issue, yes, you may have an interview online, but I think the university by far and away wants to get to know you as much as possible. And I think that that's, stands to reason from their portfolio and the personal statement, blah, blah, blah. So I think, you could probably expect them going back to
I think as we're
in-person.
recording this, Sydney has entered a
Yeah.
2-week lockdown. So
who knows at this stage? But if people get their vaccines, guys, get your vaccines.
you get your vaccines, exactly.
If we can all get vaccinated, I think looking forward, it'll go back to that same MMI format. So in terms of what happened for me on the day, I sort of went in. As you would normally. They give you, I think there are a few sessions throughout the day. So I had a lunchtime session. It was a whirlwind. You're sitting in this room full of all these other applicants, and people are kind of nice, but also sort of sizing you up at the same time. And it's kind of a bit of a bullpen. And then the university dean comes in and has a chat to you all, which is quite nice, but also very scary at the same time. And you're thinking, is this part of the test? You're like, what's going on here? But
when can I stop being nice?
Yeah. I'm smiling a lot. Yeah, so it's an unusual place to be, and I think as soon as you walk into the university, you are on record, and you can assume that the assessment has started in some way. I think that, then you go into these rooms and you undertake your MMI, and that just works in any other, as standard for any other university. I don't think Notre Dame has any particular, things about it that make it unusual. I know at other universities there are MMIs and panel interviews together. So it's no surprises. MMI, I think compared to universities like Melbourne, the MMI stations themselves run for a little bit longer.
But we'll have a separate episode deep diving into the mechanics of MMI in a bit. So you're saying cut and dry MMI, basically? Cut and dry MMI.
That's really all there is to it. I mean, you have a rest station in there somewhere where you can collect your thoughts and think about all the mistakes you've made.
Or not.
Or not. In my case, there were many mistakes.
So you're saying that you had quite a stressful MMI experience. What did you do, I guess, before the stations and before the rest or during the rest station to de-stress? Any strategies?
The biggest fear that I had, and I think it's a reasonable fear to have, is that I would misread the station on the door and go in and say something that just was not on topic. And I think, as someone who's examined various things throughout my career, you need to answer the question to then accurately assess this person's understanding of what they've said. And if someone's off track completely from the get-go, it's very hard to mark them highly. So
even if what they said was reasonable,
great,
if they're off target.
If they're off target, then
Can't
they're
give
just
them
off target.
marks.
And ultimately, they need people that are going to be accurate in their medical school. So,
Right.
This is something that, is important to get right. So that was something that I did. But after I'd read it, I would try to sort of just de-stress, take a breather, and then reread the question again and be like, yes, I'm sure that I've understood the crux of what this station is asking of me. And then I would think about my first opening sentence for answering the question. If I think about a plan too much, it trips me up. But what I need is a good one-liner to get the ball rolling for me. Once I've hit the ground running, then I tend to be reasonably coherent with what I'm saying.
So it's about rereading the question at the door, collecting yourself, and preparing that first line so you can really have a soft landing at the
absolutely.
station.
And I think that the mindfulness techniques really do play into it. I think thinking about your exhale and your breath and really trying to calm down. And there are loads of resources online of how to do this, but it's very important that you're able to get a hold of yourself at the door for your MMI interviews. If you have a stuff up in a station, like I had a stuff up in my stations as well, and you need to be able to think, okay, that station is done. I'm next station, and then rinse, repeat. And it was a whirlwind, that whole MMI process.
Went by quick. All right, we've talked your guys' ears off today about Notre Dame. I guess we've tried to squeeze the scope of the university and the interview into a very brief and hopefully somewhat enjoyable podcast. So we'll wrap things up here, and we'll ask Mitch. Mitch, do you have any other comments? Funny stories, outstanding, interesting facts?
No, I think I've given you all that I have about the university. But ultimately, I think just to say that it's a fantastic university. Don't be put off by the religious element. It's not
Not an issue.
It's not an issue. And for people from different religions, people who may feel like, their sexuality or anything like that might prohibit them from attending a Catholic institution, please don't be put off by something like that. There are people of all walks of life from, every background possible, with every orientation at the university, and it shouldn't be something that prevents you from applying, because if you've got the skills and you've got the reflective social justice character,
and they want you.
The university wants you ultimately. So please do apply.
They'll support you.
And they will support you, absolutely. And the student cohorts themselves are immensely supportive as well. So I would not be put off by that, and definitely apply.
All right. How much did Notre Dame pay you to say that?
A lot of money.
All right. Thank you so much, guys, for tuning in, and we'll see you on the next episode of the Pre-Admission Game.
Yeah, thanks.